Hello, my name is Rachel Waltz. I'm the manager of the Orange County Partnership to End Homelessness. Welcome to our Homelessness 201 presentation, brought to you by our friends and colleagues at Chapel of the Cross in Chapel Hill, North Carolina. Today's presentation will be followed next Sunday with a live panel presentation brought to you by a number of service providers in Orange County working to end homelessness, as well as somebody with direct lived experience. So moving in a bit, we're first going to be talking a bit more closely about the context of homelessness in Orange County, as well as giving some background in the gaps analysis, which is really going to be our primary focus today, particularly looking at what are some existing gaps in our system, how do we fill them, and why are we filling them. Last week, we really focused on the beginnings of modern homelessness in our society, including external factors and the policy responses. We also cooked up a steaming batch of acronym alphabet soup involving players at the federal, state, and local levels. And we also talked about the evolution of homeless services from a charity-based and program-based framework to really a social justice and systems-based thinking. We also talked a bit about the continuum of care, which the Orange County Partnership to End Homelessness serves as the continuum of care in our community, and how the continuum of care operates both kind of managing the funding competitions, as well as refers to the geographic confines of the area that we're serving. We talked a bit about how the continuum of care provides a lot of coordination, a lot of meetings. And then finally, we looked at data last week, particularly two sets of HUD managed data. One is the point in time count, which is that kind of head count of people who are living sheltered and unsheltered in our community. That's typically the last Wednesday in January. And we also looked at the system performance measures, which we'll touch on a bit more in depth today. Really those measures and metrics of how are we doing as a system, and are we moving closer towards our goals of ending homelessness or moving further away? And we try to use that information to inform how we're kind of targeting our responses. So just as a reminder, we can end homelessness in Orange County. Modern homelessness had a start, and it has had an end in some communities. Other communities are already doing this, and they have done it. And we know what to do, and we know how to do it. There's a breadth and depth of research, including housing first policies and harm reduction, permanent supportive housing. There's a number of techniques and practices that really involve some effective partnering with the folks that we're serving, folks with lived experience, because people who are closest to issues really are essential to our planning with how we're ending these issues. And so we also want to give you guys a kind of a framework for today of what would it look like, what would it mean to end homelessness in Orange County. So first, a little bit of context in our community. Like we talked about last week, the most recent point in time count numbers that were from January 27th of 2021. Again, it was that head count of people who are living outside, people living in shelters, and people living in transitional housing are all counted as homeless. And there were a total of 176 people experiencing homelessness in our community this past January. And that included a significant increase in the number of people who are living unsheltered. We also talked a bit about how folks in our community go from experiencing homelessness to moving into permanent housing. And the mechanism of that is coordinated entry. And so in our community, Orange County was really an early adopter of an innovative practice that is typically referred to as like the by name list. In our community, we call it the Home Committee. And so it is a collection of service providers who get together monthly. Actually, it's bi-monthly now, because demand has continued to grow, and all working, trying to row in the same direction of serving people and targeting limited resources to people who need them the most. And so we've continued to see the number of people on the home committee rise and continue to rise pretty drastically. So for a number of years, the number of people or households on the home committee were around 60, maybe 80, flatlined over the last couple of years to around 100. And then starting kind of late 2020, starting soon after the pandemic began in March 2020, those numbers really started to rise. And so now there are about 160 households who are on the home committee. That means people who are experiencing homelessness, either unsheltered or sheltered, and who are connected in a meaningful way with a service provider in our community. At the same time that demand for those services has grown, we've also helped support more households exit to permanent housing than ever before. So far, as of the end of September 2021, 116 households exited to housing. And that's more than we've had in any previous year. And that really speaks to the power of collaboration across service providers with partners like the Interfaith Council, the Community Empowerment Fund, Compass, UNC's HomeLink program, the Department of Social Services, really cuts a broad swath of providers and partners. At the same time, though, as we talked about, as we looked at those numbers rising more broadly, there are subpopulations that are seeing different outcomes here. And so, when we talk about ending homelessness, many communities have actually ended homelessness for people experiencing chronic homelessness, for homeless veterans. And it's really concerning that the number of people experiencing chronic homelessness in our community has continued to rise after really making significant progress, reducing it from 2010 through till 2017. So that's incredibly concerning, given the way that we've already attempted to target a lot of supports and permanent housing options to people experiencing chronic homelessness. We've also seen that the percentage of people experiencing chronic homelessness living unsheltered has also continued to grow over the last couple of years, and that can lead to all kinds of poor health outcomes and other risk factors. We've also seen the number of families experiencing homelessness. It has declined a bit, but there's still a persistent number of families experiencing homelessness. And we've heard anecdotally from service providers that families are actually staying in unsafe living situations longer, situations where there may be violence at home because of the isolation brought on by COVID-19. And then finally, looking at veteran homelessness, there has really been significant investments in ending veteran homelessness kind of across the board with state, federal, and local players. And we really have not seen that number budge, which is also incredibly concerning. So I want to move next into our discussion of how we arrived at our gaps analysis. We spoke last week about the move from a kind of charity and program-based model to thinking of homeless services as more of a continuum and a network of providers and a system. And so the creation of data has really helped us think in more of a systems frame. And so in 2016 and early 2017, the Orange County Partnership to End Homelessness convened a series of meetings with stakeholders. So people experiencing homelessness, homeless service providers, community leaders, and state homelessness experts to map the existing system and to really try to identify gaps that are in the existing system. Through those meetings with stakeholders, gaps were prioritized as folks have different frames of reference. And these gaps are updated at least annually through work with community members, including people with direct and lived experience of homelessness and navigating these systems. We recognize when people are experiencing a housing crisis, the ability to navigate complex systems with at times high administrative burden is not trauma informed and does not lead us towards a pathway of ending homelessness. So really hearing directly from people who are using these systems and moving through these systems really helps inform our approaches to reduce that load on folks and make it as easy as possible to access the right service at the right time. So again, as a quick recap, what we see here are the system performance measures that were kind of rooted in research that really help look at drivers. These are metrics that really help us drive moves towards ensuring that homelessness is rare, brief, and one-time occurrence. Again, when we talk about ending homelessness, we're not talking about that no one is ever homeless ever again. People do experience housing crises, but we want to make sure that when people do experience homelessness, that we're able to go from a housing crisis to obtaining permanent stable housing in no more than 90 days. We want to make sure that when people do find housing, that they don't return to homelessness. And so with a focus on these metrics, it really helps us kind of target where we're placing interventions and where we're prioritizing. So moving into the gaps themselves. And we've got the link of the current gaps analysis in the presentation here, and it's also linked on the Orange County Partnership website. So we have made some progress in filling gaps since that exercise in 2017. There are currently 14 system gaps, and within that, in addition to that, there are 3 gaps that are currently filled. So one is a housing access coordinator who kind of works at that systems level, making sure that we have enough or affordable housing in Orange County. Key takeaway there is that we do not. There are a lot of people who have rental subsidies or significant income on their own, but they cannot afford to live in Orange County. We've heard from colleagues and partners that 90% of people who work in Chapel Hill do not live in Chapel Hill. So the other gaps that have been filled are our street outreach team, which was filled last fall, so fall of 2020, and is currently a collaboration between the Orange County Partnership to End Homelessness and the Criminal Justice Resource Department. So our street outreach team operates as a street outreach harm reduction and deflection team because we recognize that people who are experiencing unsheltered homelessness are also more likely to be involved in the criminal justice system for relatively low-level offenses. And we know that burdensome court costs and fines and fees do nothing to help people obtain permanent housing, and in fact make it harder at times due to things like background checks. So the addition of a street outreach team has been a huge advancement and a huge win for our community. And then the last gap that's currently filled is our homelessness diversion funds. So for many people, they may need a kind of small but flexible pot of funds to help with things like maybe someone is staying with a family member or friend, and there's a bit of conflict, and some may be playing their music too loudly. And so we've learned from partners across the community, across the country, that sometimes something as simple as like buying a pair of headphones can really ease conflict or tension within a household. Also, our coordinated entry team has spoken with folks and served folks who had job opportunities out of state, but just literally could not afford the bus ticket to get there. And so that pot of flexible funding has really helped to divert a number of folks from even having to enter the homeless system in our community. And then additionally, there are 8 gaps that have had some activity underway, but are not fully filled. And so we know that in order to end homelessness in Orange County, we must fill the remaining gaps. So the gaps in our current system really fall into 4 main buckets. The first is housing, like just pure and simple housing. The second is temporary housing, which usually has a level of kind of services connected. The next is connections. When we talked last week, we spoke about how for many folks, obtaining permanent housing is not just about kind of the financial piece, but also about the kind of social supports, and they can be formal or informal to help maintain housing. How to build good relationships with your neighbors or your landlord, things like that. And so those connections can be really critical. And then the final kind of bucket when we think about the gaps is really rooted in just the inherent worth and dignity that everyone in our community deserves. So we will move a bit more closely into those gaps in detail. So the first gap that is partially filled is a rapid rehousing program. So rapid rehousing is a short-term evidence-based program that's a collection of services and financial assistance for people with mid-range service needs. Like all Housing First programs, it's designed to be low barrier. So it's designed to serve all people and doesn't require things like sobriety or participation in services or kind of demonstration of readiness. And it's also highly flexible. There's not a cookie cutter model or a one size fits all. So some folks may need assistance with some folks may need rental assistance. Other folks may need just to pay a security deposit or help with an old eviction to really kind of get into permanent housing that they're then able to maintain independently. And so there's three core components. Again, our housing identification, rent and move-in assistance, and case management. One of the common questions we hear is, why rapid rehousing rather than something like transitional housing? And we talked a bit about transitional housing last week, but again, through research and evidence, we know that rapid rehousing is actually less expensive over time. It shortens the length of time that people experience homelessness, and it serves higher need folks in a way that transitional housing does not kind of adequately typically meet folks' needs when it comes to making lasting service connections. So a fully funded best practice rapid rehousing program to fill the existing gap of the 160 households that we talked about who are currently experiencing homelessness in our community would involve 5 full-time case manager positions. We currently have funding for rapid rehousing services, but not financial assistance through the state emergency solutions grant funding. So again, looking at each case manager serving about 30 households over the course of a year. And then next is that financial assistance piece. So to serve 160 households per year, that's a little over $1 million, with the assumption that each household would require about $1,200 of support in rental or utility assistance. So a total program cost there of just under $1.4 million. The next housing gap that we're going to talk about is permanent supportive housing, which is another evidence-based best practice program that's partially funded. Permanent supportive housing provides long-term rental assistance and voluntary supportive services for people experiencing chronic homelessness. PSH is also a housing first model that's designed to serve all people. It doesn't require sobriety or service requirements or things of that nature. And it also is highly flexible. And we also know that permanent supportive housing in our community, but also across the country, has really led to significant reductions in chronic homelessness, particularly in the 2010s. Although we have started to see numbers of chronic homelessness rise in the last few years. We also know that permanent supportive housing is less expensive than the alternatives. Typically, people who are experiencing chronic homelessness and have high service needs are much more likely to utilize the emergency department, be court involved, and potentially in and out of the criminal justice system like jails and prisons, or involved with other institutions like mental health or substance use providers. PSH also shortens the length of time that people experience homelessness. And again, it serves higher need people with higher level service needs. and research shows that it works. This is a link to a recent lit review from The Lancet. So a fully funded best practice permanent supportive housing program in order to fill the gap would actually involve 3 full-time case manager positions. There's currently 2 full-time case managers through IFC, which again operates a really excellent best practice program, and also to cover overhead and IFC. Total cost there would be $200,000. So like we said, if we filled these 2 gaps for rapid rehousing and permanent supportive housing, which are both considered permanent housing, would increase the number of people housed directly from the home list. And then again, moving from that kind of individual program and participant level, but thinking about the system, the more quickly we can house people from the home list, it decreases the system-wide length of time that people experience homelessness. And it also frees up beds at shelters, so allows more people to enter into the system who need it most. There's a little context there that, again, about 160 households on the home list, and demonstrated success over the last year with 37 people served through the rapid rehousing program. The Interfaith Council has served additionally another about 40 people. So moving next to a housing locator. So a housing locator would provide client level assistance in helping folks locate units, particularly focusing on people who already have housing choice vouchers in hand and other people at risk of homelessness who may contact the Housing Helpline, which again is kind of that one of the points of access into our coordinated entry system. The housing locator would provide kind of that client level assistance while working in close collaboration with the housing access coordinator to develop and maintain landlord relationships. Because again, part of the mission and the goal is, yes, providing support to help people obtain and maintain housing, but also building and maintaining those relationships with landlords and property managers to really create win-win situations across the community. And like we said, when we think about kind of a ready referral source, there's over 160 households on the home committee list. These are all households that are experiencing homelessness. They're in active housing search, most of whom already have a rental subsidy in hand. They literally just need to find a unit. And they're already connected with service providers or people who can help them with completing applications and gathering income documentation, those types of supports. And again, kind of looking at that housing piece a little bit, that supply piece that the housing locator would continue to work on is this idea that the more kind of income-based units that we have, or units where property managers or landlords are willing to partner with existing programs, again, decreases the length of time that people are experiencing homelessness and increases those exits to homelessness. And so again, when people are able to exit quicker, it increases bed availability at shelters. And data also shows us that housing subsidies are the #1 predictor of long-term stability. So again, looking to reduce the number of people who return to homelessness, following obtaining housing. So a housing locator, as a total program cost, would be $67,000. And then moving into the next piece, when we talk about, again, partnering with people who own property in our community, the Orange County Housing and Community Development has made some pretty significant strides in recent years to really listen to property managers and landlords, hear what concerns and experiences folks may have, and then work to address those concerns. And so one of the housing gaps that has some funding that was implemented in 2020 with some CARES funds and housing choice voucher funds, but is now looking for sustained funding, would provide landlords with, as the name suggests, incentive funds for signing new leases as well as renewing leases with programs like the Housing Choice Voucher Program or Rapid Rehousing, as well as veterans programs and clients working with the local reentry council, Compass Center, and others. and this program is managed by our housing access coordinator. So when we look at what a fully funded landlord incentive program would look like, looking at about 100 new leases each year with an incentive of $1,000 per new lease, and then 200 renewal leases each year with incentives of $500 a piece. That total program cost would be $200,000. And again, these funds flowing, particularly for focusing on local landlords, really back into our community. The next housing gap is a youth homes program. While youth homelessness generally has been fairly stable in our community, it has started to rise in this last year. And the LGBTQ Center of Durham developed a program to provide housing, therapy, and case management for youth ages 18 to 24 who are exiting homelessness in Orange County. The LGBTQ Center really spearheaded these efforts because LGBTQ youth are much more likely to experience homelessness than non-LGBTQ youth, although the Youth Homes program serves both LGBTQ and non-LGBTQ folks age 18 to 24. Additionally, the Youth Homes program really revamped the way that they were intervening in response to COVID. And so they moved from a host home program to much more of a rapid rehousing model of rental assistance and supportive services. And so the youth home gap that currently exists would provide for staff salaries, including 1/3 of the program director and case manager, as well as therapy services, which would be contracted with mental health providers, and then that rental assistance or utility assistance as kind of housing expenses for 7 clients for an average of 12 months. And then with the overhead, that total program cost would be $162,160. And then the last housing gap we're going to talk about here is for household goods. Oftentimes when people are experiencing homelessness, they may have had to get rid of their belongings or sell them or leave them behind or found them on the street one day. And so people who are exiting homelessness into housing often have little to no furniture to really turn a house into a home and a place, again, that we talked about last week, the kind of boost that you get and relief that you get walking into your space, seeing your things. And so oftentimes people who are leaving the shelter or street homelessness to find the first permanent home in some time may lack some really basic things like linens and dishes and cleaning supplies. And so as we think about this as kind of a partially filled gap, there are current partners like the Furniture Project, St. Thomas More here in Chapel Hill, as well as Community Works over in Carborough that offer a number of options. However, gaps really remain for returning clients. Many programs just don't have the resources to be able to provide furnishings to a household more than once. There also are concerns about, and some of these programs don't provide services to people who are residing currently in Ashley Forest. And then there also just is not the bandwidth to kind of meet the community need for all people who are exiting homelessness into permanent housing in our community. And we also know that a best practice program really allows for flexibility and client choice to pick both what they like and what they need. Again, really trying to move away from kind of that charity model, cookie cutter model of like, I feel good to give and you should feel grateful to receive, but really rooted in again, kind of empowerment and just basic dignity and respect. And so the budget here that we're talking about would support 200 households moving from homelessness into housing of about $800 each. So that would be $160,000. Moving next into temporary housing gaps. So first one here that we're going to talk about is an accessible and housing-focused shelter. The Interfaith Council for Social Services provides emergency shelter and transitional housing in our community. It does a really excellent job. They're just a wonderful partner. And HUD recommends that emergency shelter has really low barriers to entry, including the ability to walk up and access a bed. same day. And unfortunately, right now, in order for people to access community house, which has to operate as a transitional housing program, people sometimes wait days, weeks, or months to enter. So someone could be experiencing homelessness tonight. They could call the Housing Helpline and get on the shelter referral list. And it could be a very highly variable amount of time before they're contacted and told that a bed may be available for them. Again, a shelter that's integrating a housing-focused a shelter that's integrated in a housing-focused system is also that best approach to, again, move as quickly as possible from that housing crisis into permanent housing. And some of the barriers that exist for IFC to operate a really best practice shelter, emergency shelter, is the existing Good Neighbor Plan. Because of where the IFC community house is sited, there's a number of stipulations there that currently prohibit them from operating some of those best practices. And so, again, depending on the approach that the community decides to take, the funding pathway really changes. So if there were alterations to the Good Neighbor Plan, the IFC shelter would need some modest retooling, including some additional staffing and training for $194,000. Otherwise, a new emergency shelter would have to be constructed, which would cost a little over $3 million in construction and staffing costs. The next temporary housing gap is medical respite beds. Currently, there are patients in our healthcare facilities who have relatively low-level medical needs, but they can become long-term hospital stayers or get discharged to homelessness because of the lack of a kind of respite or step-down option. And so the concept with a medical respite bed would be that work on kind of a nursing home-based model, but patients could receive 2 to 6 weeks of medical respite to address some kind of lower level medical needs, things like wound care or the provision of IV medication. But at that same time, there would be a chance to provide housing-focused supported services to help folks make those housing plans while they're in a kind of nursing home type of environment. And so we've been working with the UNC Healthcare and homeless service providers on this model for a 5-bed proposal with some potential funding by UNC Healthcare that would both increase the capacity of needed hospital beds, but also ensure that people who are experiencing homelessness are getting the care they need. And the budget to that is to be determined. The next temporary housing gap is bridge housing. So currently, there are kind of local reentry councils across a number of communities in North Carolina. And so the Orange County Local Reentry Council is seeing about 65 people exiting jail or prison each year who need short-term, low-barrier housing to help address some reentry needs and reintegrate into the community, especially during COVID. We also know that the ability to find safe, stable housing and employment are 2 of the biggest contributors to helping folks not enter back into the criminal justice system. And so bridge housing and supportive services is really an evidence-based best practice for ensuring stabilization and support for people re-entering from incarceration. It's also been identified as a critical priority by U.S. HUD Secretary Marcia Fudge. So currently in our community, Reentry House Plus opened this past summer of 2021, and it provides bridge housing to 3 participants, plus a peer house manager in a house in our community. And it also provides one-on-one case management and peer mentoring. Additionally, we have looked at kind of hoteling to also provide some of those kind of short-term, up to 60-day stays while people explore additional housing options. And so a budget for bridge housing would look to serve 55 people in hotels, averaging again 60 nights at about $55 a night, as well as those supportive services. So some SWIP classes that again provide some education and case management and peer-based mentoring, focusing on reentry needs. And so that total program cost is $220,000. So moving from temporary housing next into kind of services and connections that folks need. So, so the first is an integrated service center. Again, we talk about trying to reduce the administrative burden on people who are already experiencing housing crisis, having to make a bunch of phone calls or kind of hop from one place to the other all day, oftentimes to not really get told helpful information. Again, just moves us further away from our goals. And so having one-stop drop-in access to services aimed towards people experiencing housing crisis, again, is really the most effective way to help address these issues. And so the IFC Commons opened in Carborough in January of 2021, provides things like bathrooms and showers and service navigation. And so again, some next steps here are continuing some community conversations to see about integrating more fully with medical care and recovery services. And again, with a really clear focus on providing trauma-informed and client-centered kind of services, and being kind of that welcoming environment. And so that budget is to be determined. So when we think about what that multi-center service could do and how it would impact our gaps, it would, again, reduce those barriers to service connection. So for people who are maybe looking for homelessness prevention, it could actually decrease first-time homelessness. And in doing so, that would decrease the number of people experiencing homelessness. And then also increase service connections for people, particularly for people who are living unsheltered, who may not have supports or things on site. The next gap when it comes to connections is a crisis diversion facility. So many times when people experience behavioral health crises, they're oftentimes taken to fairly restrictive or institutional settings, typically like jail or hospital. And so a best practice crisis diversion facility would provide anyone, anywhere, anytime support in a calming and non-institutional setting. Again, for people who are experiencing crisis, the notion of being in a space that is oftentimes loud and chaotic and confusing, where people may not have the ability to exhibit or exert any kind of control over their surroundings, can many times be an even more destabilizing factor. And so the notion of a crisis diversion facility, again, would be for some of those kind of non-acute settings where people may not need a kind of a locked facility, but they could benefit from some therapeutic supports, again, non-acute medical care, potentially an on-site pharmacy to fill prescriptions, as well as linkages to community treatment options and social service providers. And so the Orange County Behavioral Health Task Force has been convening conversations with stakeholders across the community for quite some time, because again, this need really cuts across so many different systems. And so a budget for that is to be determined. The next connections gap is the Housing Helpline. So like we talked about last week, the Orange County Housing Helpline is the kind of centralized point of access for people in housing crisis. The helpline staff help kind of address things like eviction prevention, homelessness prevention and diversion, as well as helping people access emergency shelter. They also provide information and referrals more broadly for people who are maybe outside of that immediate housing crisis, but want some just long-term assistance about things like more affordable housing. And people currently connect with the Housing Helpline by phone or email, and also walk-up service at the Southern Human Service Center in Chapel Hill. The Housing Helpline staff receive over 100 calls a day and provide assistance in a trauma-informed and client-centered approach. Again, when people are in that kind of crisis mentality where there just aren't a lot of options, it's really critical that that they are partnering with well-trained staff who know how to effectively help people kind of assess their situation, explore resources and alternatives, troubleshoot, and then make a plan. And the increased volume of calls and emails during COVID, particularly with COVID-related housing crises, including some of these most recent changes in the eviction moratorium, have really increased the need for additional staffing. And so right now, a fully funded housing helpline. So we currently have 2 coordinated entry specialists who have ongoing funding from a Continuum of Care HUD grant. There is one-time grant funding through June 2022 for 4 additional coordinated entry specialists. And the gap here is really looking for salary and benefit support for 2 coordinated entry specialists for July 22 and beyond. And that is a cost of $161,000. Moving into our last set of gaps. Revolve around dignity. So the first gap here is really having 24-hour bathroom access in downtown Chapel Hill. I don't know about you all, but I have a 3-year-old right now, and he doesn't always pick the most opportune times to find a restroom. And so 24-hour bathroom access in downtown would really be a benefit to everybody in our community. And so again, when we think about what that would look like, again, it would be free, it would be accessible. The funding target for this really depends on the approach. Again, there is partial access now. The Waltz deck bathrooms are open during the day, and the town commons restroom is open during daylight hours, as is the IFC commons. And the next steps are working with the Town of Chapel Hill Working Group to explore some recommendations. And again, when thinking about what impacts having an accessible downtown restroom would entail, is just really increase the livability for many frequent users, but also just afford folks some basic human dignity. And then the last gap is memorial service funding. So many people who experience homelessness or have histories of homelessness are medically fragile. They also have much higher rates of morbidity and mortality. And again, we talked earlier about kind of notions of kind of natural or formal supports. A lot of times people who are experiencing homelessness, most of their community supports may be other people who are experiencing homelessness. And so there may not be additional funds to help support kind of that time when we should be focusing on mourning and remembering folks. And so in December of 2020, the Community Empowerment Fund held a vigil for some members who passed away in 2020. And during that vigil, community members expressed interest in a GoFundMe to really establish some funding. And so funding would enable service providers to focus on providing closure and remembrance for community members rather than scrambling around to try to find funding. And so the budget for this would be figures to about $1,000 for basic funeral arrangements for 5 people a year for a total of $5,000. That was a lot that I threw at you. But again, I think the takeaways really are that ending homelessness takes some broad-based community solutions. It is housing for sure, but it's also some of these other points that really focus on, again, those service connections, those the interplay and the exchange within the homeless service system and the healthcare system, and planning and education. And so it really does take a big tent again to make progress towards our goals of ending homelessness. So thank you so much for your interest. If you'd like to do more, please feel free to follow, share, and retweet us on Twitter, follow the Facebook, check out our website. We also have our annual point in time count in January, so there'll be more information to come on that in the coming weeks with some training and information about how to volunteer. And then ongoing, there are a bevy of Orange County Partnership and homelessness groups and committees, always looking for people who care about these issues, who want to get more involved. And then also, what you can do, in and out every day is talk to the people who are in your community about these issues and helping dispel some of the myths that we talked about last week. and pointing folks in the right direction. So again, if you are coming across folks who may need some assistance, please direct them to the Housing Helpline. Or if people are experiencing street homelessness, please direct them to the street outreach team. You can also contact the street outreach team directly, and they will respond. And then we also have a community resource database through the OC Connect system. So again, my name is Rachel Waltz. You can find me at our Waltz at orangecounty.nc.gov at the phone number provided. And yeah, really appreciate any feedback, any thoughts you may have, and I look forward to staying in touch. Thank you so much.